Hi everyone, Dr. is here, and this is the second video talking about methods of treatment of fibroid uterus. Please refer to the first video. We talked about the symptoms and how to diagnose fibroids. Now, uterine fibroids or uterine myomas, usually, as we said, they are benign tumors and they rarely convert to cancer. Now, methods of treatment of fibroid uterus or uterine fibroids. We can divide it into one which is a medical, and the second one conservative but invasive, and the third one the surgical, which is the main surgical lines of treatment. Now, the medical part, one is the birth control pills, and usually that's to help to decrease the amount of bleeding every month, and usually that's effective in decreasing the amount of bleeding and indicated for younger patients with heavy periods. Second thing is progesterone-coated IUD or called Mirena IUD, and that's you insert the IUD inside the cavity of the uterus, and the IUD will be in touch of the wall of the uterus. The progesterone will decrease the thickness of the lining and therefore decreases the amount of bleeding that the patient loses the amount of blood that the patient loses every month. The third one is the injection, it's called Lupron, and usually Lupron is used for no more than 6 months time frame because the side effects is bad. The main side effect is the osteoporosis. Therefore, we usually use Lupron when we plan surgery for patients who have a very big, large fibroid uterus because Lupron helps to shrink the fibroid. Number four is non-hormonal medical treatment like Lestida, and these medications the patient use this medication during the days of the heavy period, and so that's as needed or during the period time. So it's not for longer time or longer duration of treatment. The second line of treatment, we said the invasive but conservative. Conservative because we don't remove the fibroids, we don't remove the uterus, but invasive because we have to use a small surgical procedure. So number one is in uterine artery embolization, and in this situation we close the blood vessels that supplies the fibroid, and simply when less blood goes to the fibroid doesn't grow and start to shrink in size, and therefore will save patient bigger surgery. Second conservative surgical procedure is laparoscopic radiofrequency ablation, and in this situation we use ultrasound to help to shrink the fibroids. Third line of treatment, which is conservative still but surgical procedure, is endometrial ablation. And in this situation, there are many ways to do the endometrial ablation. And the purpose of this procedure is to basically scar the lining of the uterus so the patient doesn't bleed. Yet, you don't remove the fibroids, you don't remove the uterus. Now we go to the third line of treatment, which is surgical treatment. And in this surgical treatment, either we remove the fibroids or we remove the uterus. And really, it depends on the patient's need and where she is as far as her family is concerned. If she's planning to have kids, therefore we plan to remove the fibroids and leave the uterus. If she's not planning to have any kids or she completed her family, then we plan to remove the uterus along with the fibroids. Now, removing the fibroids is usually called myomectomy, and that can be done by laparoscope, it's called laparoscopic myomectomy, or can be done by robot, which is called robotic myomectomy, or via incision in the abdomen, and usually we do it through a C-section incision. Laparoscopic, robotic, or open myomectomy. It depends on the patient desire, patient's need, the size of the fibroids, and the surgeon's skills. The second procedure is hysterectomy or removing the uterus, and that can be done by using the laparoscope, so laparoscopic hysterectomy, or the robot like robotic hysterectomy, or open incision like a C-section incision. And again, that depends on the skills of the surgeon and the patient's need and the size of the fibroids. This is basically all the lines of treatment of the fibroid, to summarize all of them. So therefore, you can discuss any line of treatment with your doctor, and you can make up the plan that fits your needs. Thank you so much and good luck.